Hello dear colleagues, my name is Dr. Shkolnyi. I am a dermatologist and certified trainer for Yuma Medical, Chief Medical Officer and leading specialist in laser and injection treatments at the Yuma Medical Center. Today we will discuss how to work with TwAc 2.0 in the neck and decollete areas. The main indicators include skin laxity, dryness, wrinkles and the appearance of so-called venous rings, skin discoloration, pigmentation and papillomas. Mechanism of action of PDRN. TwAc 2.0 enhances collagen and elastin synthesis, increases the metabolic activity of cells, and reduces melanin production in the skin. Thanks to the polynucleotides in TwAc 2.0, the amount of nitric oxide and VEGF factor in the peripheral bloodstream increases. This leads to vasodilation and the growth of new collateral vessels and reduction in tissue swelling. Application of TwAc 2.0 in the neck and decollete areas. Inject 3 ml of TwAc 2.0 once every 14 days. With standard course of 2 to 3 sessions. It is recommended to repeat course after 6 months. Injection technique. Use retrograde injection technique. On an average depth of 4 mm. There should be no significant dermal infiltration or so-called papules. Deep small bumps are acceptable. It is also useful to remember the deeper the injection, the less painful it is for the patient.